Let us now go to diagnosis according to Zhang Fu organ patterns. The topic is liver and heart blood deficiency. When there is liver blood deficiency, it will often lead to heart blood deficiency because the liver and heart have a very close relationship to blood. The liver stores blood and the heart governs blood. Furthermore, the liver blood anchors and nourishes the Hun, whilst the heart blood anchors and nourishes the Shen. The Hun is that which follows the Shen in its entering and exiting. Insomnia will be an important sign of liver and heart blood deficiency. There are three main causes of liver and heart blood deficiency. First is poor production of blood. Second is insufficient consumption of food that nourishes blood, and the loss of blood through bleeding or the consumption of blood through excessive physical training and excessive mental activity. Poor production of blood will be due to weakness of the organs involved in blood production. This will be due to etiological factors that weaken the spleen and kidneys and will eventually lead to liver and heart blood deficiency. Even if the spleen and kidneys are strong enough, liver and heart blood deficiency can still arise if the person's diet is deficient in foods that directly nourish blood. Blood loss during childbirth or heavy menstrual bleeding, bleeding disorders, operations, physical trauma, and so on can lead to liver and heart blood deficiency. The condition can still be present a long time after the blood loss. In some cases, this can be years later. Excessive physical activity, especially in women who train hard, can lead to liver blood deficiency. This does not only affect professional sportswomen or dancers, but can also affect women who train to run marathons, triathlons, or Ironman events, because excessive training consumes blood, which is used to nourish the muscles. This is why many women who play sports, dance, and train at high levels stop menstruating. The symptoms and signs of liver and heart blood deficiency are palpitations, dizziness, especially when getting up from a sitting or lying position, floaters in the eyes, difficulty in focusing the eyes, dry eyes or a feeling that there is grit in the eyes, sensitivity to bright light, poor night vision, poor memory, poor concentration, being easily startled, insomnia, dream-disturbed sleep, anxiety, nervousness, pale and sallow complexion, pale lips, dry skin, rigid fingernails or weak and frayed fingernails, dry hair, hair loss, numbness or tingling in the limbs, weak muscles, cramps or restless legs, especially in the evening and at night, scanty menstrual bleeding or amenorrhea, depression, sadness or lack of vision in life, a tendency to be weepy and extra sensitive during the premenstrual phase, indecisiveness, lack of charisma, excessively apologetic or self-deprecating, and the voice can lack resonance and have a hesitant quality. The tongue will be thin, pale, and dry, and the sides will be pale or orange, and the pulse will be fine or choppy. The key symptoms here are palpitations, insomnia, dizziness, floaters, sallow complexion, scanty menstrual bleeding, and pale sides of the tongue. The treatment principle is to nourish liver and heart blood. The acupuncture points to choose from are urinary bladder 15, 17, 18, 20, and 21, Ren 14, heart 7, stomach 36, spleen 6, liver 3, liver 8, and Ren 4. The needling technique to use is tonifying, and moxa can be used and should be used on urinary bladder 17. The explanation for the points used is that bladder 17 nourishes blood, while liver 3, liver 8, spleen 6, and bladder 18 nourishes liver blood. Heart 7, Ren 14, and bladder 15 nourish the heart blood. Spleen 6, stomach 36, bladder 20, and bladder 21 tonify spleen qi and thereby the production of blood. And Ren 4 tonifies yuan qi and thereby the production of blood. As a relevant advice, it is important that a person who is liver and heart blood deficient eats a diet that nourishes blood. They will benefit from eating red meat, bone marrow, and blood sausages. Eating organic liver will be especially salutary because it nourishes both blood and the liver directly. Green leaf vegetables will also be beneficial because they have a high iron content and because their green color has resonance with the liver. Other foods that nourish blood are beetroot, seaweed, dates, kidney beans, black beans, aduki beans, goji berries, angelica, and nettle tea. A person whose liver and heart blood deficient should avoid stimulants such as coffee and alcohol. As well as eating a diet that directly nourishes liver blood, the patient should eat a diet that tonifies spleen qi, that is warm prepared food that is not cold in its energy and does not produce dampness. Lying down for 20 minutes in the middle of the day is recommended so blood can return to the liver. Meditation is recommended as it can tonify the heart, and excessive training should also be discouraged. Liver and heart blood deficiency can be caused by liver blood deficiency, heart blood deficiency, and spleen qi deficiency, and can result in liver yin deficiency, heart yin deficiency, and kidney yin deficiency. Thank you so much for your attention.